she is going to start or you are going?
A warm evening to everyone. Hope everyone is safe and sound at home. And this is CCEBDM welcoming you all to WenTricKils. I would like to thank our sponsors 𝗵𝗵𝗿𝗄 and osmosis for sponsoring this event. And this is our final round of Tuf Tuck. This evening, we have among us an eminent personality, Dr. Senthilkumar sir, to be our judge. We welcome you on behalf of Agam sir. It's an honor to have you here. Welcome, sir. Next, we have our 6 participants who have successfully passed the first round and entered the finals. Let me introduce them. They are Divya Ranjit S, Roshni Devi R, Roshan RP, and 𝗂𝗵𝗿𝗲 A, Pavitra RB, and Riya. I welcome you all to this event. All the best, guys, and over to Gopi.
Good afternoon. Life has a multifaceted outlook to it. When they say each coin has 2 sides to it, each truth and each opinion or a fact has multiple sides to it. It takes a new meaning when you look at it from a certain angle or a certain perspective. So, block and tackle aims to embody that sentiment. Each participant gets a time limit of about 3 minutes where they speak for and against the topic depending upon what the judge asks them to. These are the rules. Before we begin our event, let us start by allotting the topic for the second participant, who is Divya Ranjit. Are you ready, Divya Ranjit? Can you please unmute yourself and switch on your video?
I'm ready, sir.
Yes, 1 second. It's scientist from the left. Please give us a moment. Divya Ranjit, this is your topic: conduction of human trials on drugs and other products.
Okay, sir.
Now it's Pavitra's turn to start our block and tackle.
So, can I start?
Shall we start? So, can we start?
Yeah, before starting.
Divya Ranjit, please mute yourself.
Okay.
Yes, sir.
Yeah, it's a good event organized by Agam. Especially happy to see medical students and all students taking active participation in conducting such programs. I even see professionals, this Agam Foundation doing very well. It's good. I think we can straight away go to the event. I think Pavitra is starting right now. I will tell the rules as he told, 3 minutes. So whenever I tell, you initially will start with favoring your topic. For example, Pavitra is going to present on are Indian doctors working in safe environment, right? So you will start in favoring that content. That is, you will be tackling that. In between, I may say block or tackle. When I say block, you have to switch over. You have to talk against that, against your topic content. This is follows for all 6 participants. Then I may even call tackle. Again, you have to come back favoring the topic. If possible, if time permits, I must ask questions in between. Whenever I ask you question anything, in whatever position you are, that is either tackle or block, you have to answer oriented to that. Are you able to understand? So, for example, you're in a block mode. When I ask some question, how to answer in such a way that you are blocking the content which you are going to speak. This is for all the participants. So starting will be tackling that topic given to you. In between, I may change either block or tackle. When I'm going to ask any questions, in whatever position you are, either tackle or block, you have to continue the same thing. Understood?
Yeah, so should I start with for or against the motion?
You start with
You
for.
should always start with for the motion.
Yeah, start with for the motion. I may even make it simple for against. Like that also I can. That would be easy, I think. Instead of tackle block, I will tell for against to make convenient for you.
So
now you can start now. For
3, 2.
Yeah, 𝗶𝗵𝗿, continue. You want to add on?
Time starts now.
Yeah. Oh, very good evening to one and all present here. I'm 𝗵𝗶𝗿𝗲, a second-year medical student from SR Medical College. It's an absolute pleasure for me to be here today. So every coin has 2 sides. So starting with for the motion. So India is a country where doctors are given high priority, and especially that can be sensed by the number of demand that's for a general MBBS seat. So that itself says how the doctors are treated. The doctors are treated as God, hence they have a better, safer environment compared to any other professionals over here. For example, a recent statement that was told by a healthcare city officer that was said as doctors are given full protection, especially during this COVID pandemic, in order to protect. Yes.
Against.
But on the other hand, doctors are definitely not in a safe environment. Almost 75% of violence takes place against doctors. Especially that's very evident in the recent news, how people are... doctors tend to have a very secure environment as they provided protection by the government, the officers, and given all priority, including 24-hour service, food.
What protection government?
Sir?
What protection government?
So there are various acts that is being given by the government, and also recently they have announced yesterday that there'll be especially the recent CRRIs and the 4th year MBBS students, they'll be given extra additional 10,000 rupees, and especially in the Himachal Pradesh, they're giving additional 30,000 rupees. And
okay, start speaking against.
Okay, but when we see a recent survey that was conducted by IMA, it states that doctors tend to face 75% of the violence, and this is definitely not accepted. And every doctor who works in the emergency department are the ones who face the most number of violence every day. And this, even a recent study by the WHO says that India is the country which has the most number of violence. And to tackle all these, in order to prevent the violence that's taking place against the doctors, various initiatives has to be taken. Because recently, a lady, OBG was OBG doctor, she was killed. Okay, when you see that doctors, like a doctor from a COVID ward, he stated that he's feeling very content as he's able to save a couple of lives recently, and also that is because okay, when you see but not always doctors tend to get a safe environment. Like I was saying that, like OB, she was killed because she couldn't save the baby of her mother, and eventually the family started creating unnecessary violence in the hospital. And this is not just over there, this is happening all over the world, and especially in Tamil Nadu, where a lady doctor was killed because he couldn't okay, so when we see in the other aspect, here the doctors are given a lot of protection apart from the general scheme by the government, including the personal security force by various hospitals.
Are Indian doctors not been treated against that foreign nations? Comparison.
Sir, can you repeat?
Indian doctors, are they treated better compared to foreign nations?
Foreign doctors, okay.
Yeah.
So,
other countries.
Okay. Yes, sir. So in India, Okay, so to give it in a broad view, in India, we tend to treat doctors, we are giving them the first preference compared to the countries like the United States or the UK, because over there, doctors are not as prioritized as here, because here we have a lot of doctors compared to what is there in the US. So in the US, for 100,000 people, there is only 48 doctors. But then when you see foreign doctors are treated better than Indian doctors, because over there's no such violence which is taking place like India, and over there they have better security for their nation. Okay, but the Indian doctors are treated better than the foreign doctors, because here we have.
Your time is up. Your time is up.
Thank you, sir.
Okay, that was a good presentation. But I thought you will target on Indian versus other country, but okay, it was a good. You took the current scenario, COVID scenario. Like how actually other side of COVID is also there that we can't discuss here. It's okay. We are all struggling very much regarding the COVID scenario.
Thank you, sir.
Before we move on to the next participant, which is 𝗵𝗲𝗏, let us spin the wheel for deciding the topic for Roshan RP.
Yes, sir.
Are you ready, Roshan?
Yes, sir. Yes, sir. I'm ready.
The topic assigned to Roshan is commercialization/privatization of healthcare sector.
Okay, sir.
Right. Are you comfortable with the topic?
Yeah, yes, sir. Thank you, sir.
Okay. 𝗵𝗲𝗏, are you ready? Can you unmute yourself?
Yes, sir.
Your time starts in 3, 2, 1.
A very good evening. I am 𝗵𝗲𝗏𝗃 from 𝐸𝐺𝐸 Medical College, Chennai. Before starting, I wish everyone all the best. I have been allotted the topic clinical trials, including involving humans and other drugs, otherwise called as human subject research purpose. This human subject research is systemic, scientific investigation that can be either interventional or observational and involves the human beings as research subjects. COVID-19 vaccines wouldn't have arrived at the earliest if volunteers don't volunteer themselves for clinical trials. Human subject research is used in various fields, including the research into advanced biology, clinical medicine, nursing, and psychobiology.
Ranjit, against.
The conduct of human subject research involving the participation of human beings implicates a variety of ethical concerns pertaining to such values such as dignity, bodily integrity, autonomy, and even privacy. If something goes wrong, a human being faces the consequences rather than just a mouse. They also may lie or muddle the answers with bias. I would like to highlight the Edward Jenner's development of smallpox vaccine.
Ranjit, but benefits are more no, in human trials. So anyway, they are going to use that
No, sir.
benefit. Tell.
But the consequence, sir, it's a human, sir. The consequences applied to the human is more than that. So this Edward Jenner smallpox vaccine, I would highlight this incident where he injected an 8-year-old child with pus taken from a cowpox infection and deliberately exposed to an infection carrier of smallpox. Although Jenner's experiment was fortunately
Ranjit, speak for.
Okay, sir. Without doing the proper research and bringing in new drugs would cost the lives of many people of the country. Thus, the human subject research proves to be a boon in many fields, especially biotechnology. The world would not have seen many drugs, vaccines without the human subject research. Humans provide more accurate and absolute information than mice and capable of giving valuable feedback than mice. Mice, you won't be expect of giving valuable feedback from the mice. The safety and the consent of the... Yes, sir.
Half time.
So again, we have not forgotten the Nazi experiment on the concentration camp prisoners, which included the involuntary sterilization, which is a pathetic one, including the hypothermia, exposing the subjects to many threats which are not acceptable today. There are also chances that researcher may conceal certain consequences from the volunteers for their own selfishness and greediness.
Any recent human trials compared to that Nazi event? Any recent trials you know? You're telling about the Nazi, that hypothermia event.
Sir. I'm not sure. No. Yes, sir. Actually,
you might not have any human trials. Not recent, even last 50
recently,
years.
I have not yet, sir.
Yeah, okay, continue. Yeah, continue
so
again.
The most pressing question, yes, sir, in research, ethics is often not whether we should be doing research, but how can we balance or justify exposing individuals, the human subjects, to risk for the sake of advancement of science. This is not at all valuable or acceptable. In 2014, a trial for an experimental vaccine for rotavirus in India was heavily criticized for giving more than 2,000 children. Yes, sir. So,
can you speak for rotavirus?
Yes,
for rotavirus. You want to say something against rotavirus? Continue that for.
Yes, sir. If a vaccine has been introduced, definitely it has to be undergone the human clinical trials. Without involving some human clinical trials, if you're going to implement in the entire country, that's going to cost a huge amount of population. So that is why if setting the rules and regulations only, the government is going to undertake these things, and they are not going to completely leave those children who have taken those vaccines going to die or anything. So by following rules and regulations only, these trials are conducted. It is not done as such. We are doing informally, sorry. It is very formally done. So properly controlled studies with human subjects. Yes, sir. There will be inevitably be cases where research cannot meet the usual ethical safeguards. Research involves vulnerable groups of humans. Yes.
Ranjit, your time is up. Your time is up.
Okay, I'll finish it, sir. Every human is human being. Everyone has got the same sensation of pain. Then exposing them to risk for the advanced. Thank you, sir.
Okay. So I would like better if you try to, for Roche and speaker, I think, you try to correct whatever you speak and try to continue from that if possible. Both speakers spoke well, but they are prepared for, against, separate. If possible, you can correlate. When you are speaking for, when I suddenly tell block or against, you can continue the same thing if possible. That would be a little bit interesting. Okay, Roshan's topic, I think, that is a very highly hot topic. So Roshan has a good chance to speak well.
Before we move on to Roshan's topic, sir, let us decide the topic for 𝗵𝗶𝗴𝗂𝗃𝗃.
Yeah, okay.
You ready, 𝗵𝗶𝗴𝗃𝗃?
Yes, sir.
So let us spin the wheel.
Okay, sir.
Your topic is euthanasia. Roshan, your time starts in 3, 2, 1. Go on.
Greetings, jury and fellow contestants. Good evening to all. I am Roshan. I'm doing my second year at Coimbatore Medical College. So I'll be talking about commercialization and privatization of the health sector, healthcare sector. So first, I will put my point for the motion. It is for the comfort and psychological benefit that the person might be choosing a private hospital over a government hospital. But at the same time, there is a lot of investments that's occurring in the private hospitals, like for an X-ray machine or a CT or an MRI machine, blood testing equipment. And it becomes essential and fair for the individual to benefit and reap the benefit out of the investment that the person has done for his or her sector. So investment for the healthcare sector done by capital should be reaped out of it is my first point.
So patients, they will take it from the patients, you mean? That investment, what they put?
They are not exploiting the patient, but they are getting what is fair out of it, sir. What is fair and square out of it.
Speak against.
Okay, now against. Healthcare is not a luxury, it is a necessity. So man's basic needs shouldn't be a lucrative business for the private health sector community, because these days, various hospitals have taken it as a business rather than a service mentality, sir. That is against.
Continue.
And now I'll go for the motion.
No, I didn't tell anything. You continue against until I say.
Oh, against itself, I continue. Okay, sir. So health, I was telling that it is
it's half time.
Okay, it is a necessity and not a luxury. And the corporate hospitals basically have the tendency to overcharge the individuals. Fortis Hospital in Delhi, sir. Okay, reasonable charges and quality services will actually bring the people to the health sectors, which actually get proper money from the customers. Customers is nothing but the patients. If the services rendered by the hospital are up to the level in comparison to the prices that they demand, it impacts the reputation of the hospital in the long run. So the capital that they invested and the benefit that they're reaping out of it has an influence. I was talking about the corporate hospitals overcharging them. Fortis Hospital in Delhi overcharged dengue disease patients' family by 700%. A recent Times of India report said that 44% of the surgeries in India are unnecessary. In the US, thousands of surgeries have been performed without even any indication. So is it for the financial gain of the hospital? Okay. So if we are buying a Coca-Cola in a nearby shop for 25 rupees, we will be ready to buy the same Coca-Cola for 250 rupees in a five-star hotel. Are we complaining about that? But only when it comes to medicine, only when it comes to healthcare sectors, we are complaining about it. So we are only paying our own conveniences and not our.
Okay, what about if we got admitted without knowing the rate and they charge more and we are not able to pay? If they're not prior informing about the charges.
Yeah, it is the doctor's duty to inform the patient that what kind of money that surgery or anything will be costing, sir. So they will be previously informed and whether they are capable of doing the surgery or not, sir.
And I also will guide where to go, whatever it is. Against, you speak against.
Your time is
sir. In the United States, okay, I'll just finish with one line, sir.
Okay.
Ultimately, health is wealth, but it is slightly being modified in these days as wealthier is healthier, sir.
Okay, thank you, Roshan.
Thank you, sir.
The main thing, I think you could have compared a government, private, here according to price what they get, here according to price what they get, and COVID situation, you could have included, but that is little bit very sensitive thing.
Yes, sir. COVID situation. I thought of taking COVID situation, sir, but I felt it would.
Okay, you spoke well.
Thank you.
Up next is 𝗂𝗵𝗿𝗲. Before which, let us. I guess Roshni has left the meeting. We should be choosing the topic for Roshni Devi.
Wait a minute, sir. The participant has quit the meeting.
choose Ria's topic. Ria, your topic is abortion.
Yeah.
𝗵𝗵𝗿𝗲, your time starts.
Shall I start, sir?
One second. Sir, are you ready?
Yeah, you can start. Introduce yourself and you can start.
𝗵𝗿𝗲, your time starts in 3, 2, 1.
Good evening, all. I am 𝗔𝗵𝗿𝗲 from Karur Medical College. I am doing my second year. I am here to speak for and against the topic euthanasia. Euthanasia is a long, smooth-sounding word, and it conceals its danger as long, smooth words do. But the danger is there nevertheless. This is a quote from 𝗶𝗶𝗴𝗄𝗽, and let's start. The word euthanasia originated in Greece, and it means good death. Euthanasia encompasses various dimensions, from active, as in introducing something to cause death, to passive, where the treatment or supporting measures are withheld, voluntary to
Against.
involuntary, and okay, sir. And if we embrace the right to death with dignity, people with incurable and debilitating illness will be disposed from our civilized society. The practice of palliative care counters this view, as this care would provide relief from distressing symptoms and pains and support to the patient as well as the caregiver. Palliative care is an active, compassionate, and creative care for the dying. In the era
But the
of
pain
declining,
produced during palliative therapy, what about the intolerable pain produced and various side effects which they get during the palliative? So how will you
yes,
manage?
in case of those terminal illness, major importance is given based on symptom-based treatments, so that they feel less pain. Even though their life is elongated or not, the pain is reduced. That is the
half
aim
time.
of half time.
No, you continue.
Okay, sir. In the era of declining morality and justice, there is a possibility of misusing euthanasia by family members or relatives for inheriting the property of the patient. The Supreme Court has also, for euthanasia, people who have terminal illness should be allowed to die with dignity. And first petition for euthanasia to be taken to notice of law was a case of a nurse who had remained in vegetative state for about 37 years following a sexual assault. But this petition was not accepted by the law. After 5 years, the lady died of pneumonia. But here, the lady was the sufferer, though the mistake was not hers.
Which law is accepted, active or passive?
So passive is quite fine, I think, sir. But
what is active?
It is not. Active means they'll give some drugs in order to cause death, sir. Passive means withholding the supportive technical things like ventilators or something like that, sir.
So for terminal illness, you can think they may go for passive.
Yes, a passive will be, I think, without pain, sir.
Okay, against. Continue your talk.
Against. In case of making euthanasia legal, there is also a problem with black marketing of organ transplantations, because the organ transplantation is becoming more and more popular nowadays, and people who are dying by brain death or euthanasia, they are most probably ready to donate their organs nowadays. So if euthanasia is legalized, then more people will start to kill people in the name of euthanasia, and the black market for the organ transplantation will grow very well. So this is not right, sir, according to me.
Euthanasia patients will accept, right? Patients' relatives for euthanasia.
In most cases, the euthanasia patient is not in the condition to reply, sir. So the attenders or the guardians are the ones who take the decisions. Only in very few conditions.
Some they will take decision for money, you mean?
Yes, sir. As I told earlier, for inheriting their property.
Your time is up.
I speak for 30 seconds.
For euthanasia, the right to refusal of medical treatment is well recognized in law, sir, including the medical treatment that sustains or prolongs life. For example, a patient suffering from blood cancer can refuse treatment or any feeds to nasogastric tube because they are not okay with it. And this recognition of law to refuse treatment gives a way for passive euthanasia, sir. And euthanasia
Okay,
in
enough.
terminally inpatient.
So you are telling any procedure if they refuse, you should be allowed for them to refuse, even if they have survival rate.
Yes, sir. Law says that a conscious patient can refuse treatment. It is not against
you as
the
a doctor
law.
accept with that. If the patient refuses, even if he's conscious.
It depends on the condition, sir. If in case there is the patient thinks there is no meaning in their life, and most of these conditions are due to depression, sir. In such cases, psychological treatment should be given, sir. And
Okay.
whatever the condition is, killing of a life is not right according to me, sir.
So now we are speaking
without...
Okay.
I don't understand, sir.
Okay, it's good. You presented well.
Thank you, sir.
Okay.
So before we move on to Ria's turn, it's time to choose the topic for Roshni's turn. Roshni, are you ready? Can
Yes,
you please
sir.
switch on your video and audio?
Yes, sir.
Let's spin the wheel. Roshni, your topic is designer babies.
Yes, sir. Thank you, sir.
Now let's move on to Ria's turn. Ria, are you ready?
Yeah, I'm ready.
We can start.
My regards to the judge. My name is Ria, and I'm going to be speaking on the topic of abortion. The right to one's body is a basic human right, and the right to health care is also one's basic human right. So when one refuses to host a child in their body, shouldn't the medical profession or the healthcare workers aid them in solving that problem? One sorts out abortion for several reasons. One is the social reason by young mothers who cannot live with the stigma of having a child outside of marriage. And another is that abortion is an invasive medical procedure and an optional one at that. And with like any other invasive medical procedure, it comes with a list of its own complications. We have embolisms, hemorrhage, the risk of infection. Is an optional procedure really worth that risk? It has a higher mortality rate than childbirth itself. Should one opt for this?
Are you sure abortion has higher mortality rate than normal childbirth?
Yes, most abortions in India are not medical abortions. They are done rurally as well. And that has a higher mortality rate than childbirth.
Regarding medical abortion?
Medical abortions don't have that high.
No, I want you to talk against medical abortion.
All right, so medical abortion for many years.
You have to tell I am not in favor of that medical abortion.
Medical abortions are usually carried out with oxytocin, and oxytocin is only administered under the supervision of the doctor because it could lead to high complications outside of the medical environment. And even as after effects, there can be severe septicemia. And even though the risk is very less, it is severe enough to cause death. While childbirth usually does not have. Going on to the four, what are the other reasons that one chooses to take abortion? One decides to choose abortion. One is the inability to afford a child. Another is overcrowding in one's own house and inability to give enough time to every child and ensure a good life quality to that child. Also, sometimes there is severe
overcrowding. You mean overcrowding? They can conceive and then get aborted, or in favor of that?
No, sir. In India, contraceptive procedures are not very famous, and it's not as talked about. usually women don't opt for contraception as they like to keep their options open. But later on, they also realize that they cannot afford a child. In the rural setting, it's usually very common, and most as it's the in India.
You favor abortion in those cases?
Yes, sir, because vasectomies are not very common, and it's even though it's an outpatient procedure, but phlebotomies are common, and they usually happen post-abortion or post-childbirth.
So what can be done instead of abortion? In this, the meaning you'd say the overcrowding, so they don't follow proper precautions, have 3 child, 4 child, 5 child, whatever it is. Apart from abortion,
we should encourage contraceptives in the country, and we should raise awareness on it. We should not call it a taboo. There should be use of condoms, and then the properties. Yes, sir.
Against abortion.
Against abortion. Also, the easy accessibility to this procedure can reduce the stress on contraceptives, because abortions are so easily available. People don't opt for contraceptives, and this could also be a panic response by new mothers who, on sudden discovery of their pregnancy, may not favor it. Also, there is the concept of choice.
Your time is up.
Okay, ma'am, it was a good presentation. I thought you will touch on before marriage,
the legal,
that legal
yes,
issue.
Sir, I mentioned the outside marriage. I said early mothers outside of marriage could prefer
I
to
thought you will
get
touch on medical aspects, especially where it is legally accepted.
Yes.
Okay, anyway, it was a
legally,
good presentation. You were able to tackle. You were able to tackle and block. That's what this round is, right? Okay.
Yes, sir. Can I mention before I leave?
No, okay, you mentioned. No issue. Mention.
Yeah. Also in India, according to the NTP Act of 1971, we're allowed to get abortion only on 4 bases. One is if maternal health is affected, or if there is a serious deformity in the child itself, or on moral and on social grounds. So unless any of these grounds are not touched upon, one can't optionally get an abortion.
But I've told all these in favor.
Yes, I'm talking in favor of abortion. So
no, starting itself,
it should be made optional.
Okay.
Yeah.
When you're speaking itself, you could have stressed all these points. That there is no logo for these conditions. We have to do abortion, no other go, because mothers like that you could have mentioned.
Yes, sir. I didn't get to it the time.
Yeah, okay.
Yes, sir.
Okay,
Thank
next.
you.
Thank you.
Moving on, we have our final participant, Roshni. Are you ready, Roshni?
Yes, sir.
Let's start in 3, 2, 1.
I'm Roshni from ESICMC, and I'll be talking about designer babies. Basically, genetic screening of the. One second. My network is not working, sir. So can I start again? My network is not, sir.
Yes. Your network or computer network?
No, sir. I cannot. Sir, I cannot hear you, sir. 1 second, sir.
I'm able to hear you, ma'am. Roshni, continue. Your network is fine. Unmute.
Please unmute yourself, Roshni.
Yes, sir.
Your network is fine. I'm hearing everything what you speak, so speak. No problem.
Yes, sir. So designer basic is basically when after you're doing IVF, you'll have several embryos available, sir. From that, you can screen and decide which embryo is better. In this way, you can prevent several congenital diseases even before the person starts showing symptoms, like even before the person is born. This is certainly very helpful since a lot of genetic diseases can be stopped at this point. And further, how is this ethically right? So basically, this is like determining a person's value even before the person is born. This is like deciding that this person will suffer, and this will not be right even before anything has been discovered yet. Further, there's
what about if they have discovered before? That for that mother, if the designer baby is not there, she is going to have this malfunction. In that case,
yes, sir. in that case, sir, not all genetic diseases can reach the baby, sir. So, like, even if the mother is suffering from something, it is not necessary that the child will also have the same. So, like, even if the mother has certain genetic conditions, it doesn't mean the child will also have the same. So, it doesn't mean like if the mother has a condition, the child should also.
You don't want the designer baby concept at all.
Sorry, sir.
You don't want the designer baby at all. Anywhere,
Yes, sir.
For.
Yes. So basically, this gives a lot of opportunities, sir. It expands the quality and quantity of life. That is what medicine is all about. And also, when initially IVF was discovered, a lot of people were against it. Similarly, how they're against designer babies right now. So if IVF was not continued, if the study in IVF was not considered, just because people opposed it, then we will not have so much of facilities available right now. IVF has been a bigger development. Similarly, designer babies can also bring in a better change.
Against.
Further,
Half time.
Against.
Further, yes, sir. If this results in a search for the perfect human, which does not exist. So basically, just designer babies will have lead to higher expectation in the parents, which can result in a greater disappointment. Further, just because you can gene screen the baby doesn't mean that traits of the baby are related to genes. But there's this misconception that just because you can do gene screening and determine how the child will be born, that you can in fact determine how the baby is going to develop as a person, which has nothing to do with gene screening. So further, better population means a better nation, and that is exactly what medicine is all about, to increase the quantity and the quality of a person's life, which can be done by gene screening and resulting in designer babies. Being able to choose a child who does not have a congenital disease means a better future for the child itself, and preventing the child.
So you mean all can do gene screening and make all the babies born with IQ like that? In future, we want the future like that.
Yes, sir. Like right now, gene screening is only basically done only for diseases and everything. So maybe in the future it can become like that, sir. Or maybe not. But then if that does happen, means there will be this uniformity, and that is exactly what a lot of people have been going for. There'll be better IQ, and people can design how they would like things to be.
Your time is up.
So you will allow that to them decide how the baby should be?
Personally, no, sir. But because I was talking for 4, yes.
Yeah, okay. Good presentation.
Thank you, sir.
Good job, all participants. So you may take your time to decide the winners. Now let us take a break. So let's announce the results, sir.
Yeah, all 6 presented well. But anyway, some prizes have to given. I usually will give praise to everyone, even in classes. So this is just formality sake, as the event has to be given praise. And I congratulate all of you. You can clap yourself. All 6 you have come up to the stage. Even the participants initially. So everyone have did well. Can I go from 3rd to 1st or 1st to 3rd? 3rd to 1st will go.
So 3rd to 1st.
So 3rd prize is Ria. I think she spoke on abortion, right? Abortion, but I expected a little bit more. But okay, this is very difficult. In 3 minutes, time is very less. 3 minutes. Actually, it was difficult for me also to judge. In these 3 minutes, analyzing how all the 6 spoke, plus, minus, current topic. And I also listen here. The way how I have selected is your way of presentation, your way of boldness. The boldness which you show in presentation, and whether you're able to shift from 4 seconds in the correct way of manner as much as possible. And also the topic. Some difficult topics, some would have presented in a little bit easy way, which is very difficult. Easy topics, we usually speak well. So that everything I took into consideration. So I think abortion topic, who spoke? Ria, wa? Unmute Maria.
Yes, sir.
Yeah, okay. So
Yes,
she will be
sir.
given 3rd prize for today's event. Now 2nd prize, will we go?
Yes, sir.
Yeah, 2nd prize is Divya Ranjit for that human trials on drugs. You are speaking about that Nazi, all those things. And that regarding that mice, when I suddenly asked to switch, he has prepared, I think, well, having one paper plus minus something like that. That is a little bit difficult topic. But human trials to speak in favor and against. First prize goes to Roshni Devi for that designer baby. I think she was the last speaker, right?
Yes, sir.
Last but not the least. She was well prepared designer baby. She was able to answer for, against. The topic was also a little bit easy. I even considered that. In respect of that, our presentation was good. So these are my list, and all 6 did well. These are just for protocol. So they have organized like that. We have to give some prizes. So we are announcing it. Otherwise, all did well. I'm happy to see some from ESI, some from Coimbatore College, some from Viluppuram, someone told, I think. So many classes, no? Colleges.
Sir?
Participants from various districts, right?
Yes, sir. They are from different colleges.
Yeah, you people are good, doing a good thing. Daily one final, I think. Yesterday you had one event, tomorrow you are having one event. Good, keep it up. You students are only the main spirits everywhere. Okay, pa.
Yes, sir. Thank you so much for spending your time with us. The Dr. Senthil sir has a YouTube channel called Dr. Sen, which compiles videos regarding to physiology topics, where he explains them in detail. So please check it out. Let me hand over the mic to Akshada.
And a big round of applause to every participant here. And thank you guys for participating. And a hearty congratulations to all the winners. Thank you guys for making this event a grand success. And then I would like to thank Dr. Senthil sir for being a part of this event on behalf of Agam. Thank you very much, sir, for being a part of this event. And then I would also like to thank all the board members and Tuf Tuck organizing team for making it a big success. Thank you, guys. And at last, I would like to thank the sponsors, 𝗵𝗵𝗿𝗄 app and Osmosis for sponsoring us. Thank you, everyone, guys. Thank you.
Thank you, Ma. Thank you.